the weird part is I just didn't have any signs or symptoms at all, like, the whole time. Even when my labs came back, they were normal, and the only thing looking back that I can think of was after I had my baby. You know how you can't lay on your back when you're pregnant? And after I had the baby, I could finally lay on my back, and I was like, "It feels like I can't breathe professionally." This has taught me to keep an open mind and to just never stop learning, no matter what. Like, sometimes after you think you're done with school and you don't need to learn anymore, but just going through all these hard things has taught me to keep learning and studying and researching to help my family and friends and patients. I am grateful for the knowledge that I've gained and like the empathy that I gained to have with my patients that have these big long health histories. Before I was like, oh my goodness, like these people, I feel so bad for them, but they have all these things. But now I just feel like, well, I didn't do anything to get this, and they maybe didn't either, and just have more sympathy.
A tale of two hygienists.
Hello, and welcome back, listeners, to a Tale of Two Hygienists podcast, episode 533. My name is David Torres, and I'm joined with one of the best preventive specialists and educators I have ever met, my co host, Miss.
I'm Jessica Atkinson, and thanks for the intro, Dave. I appreciate you. It's always fun to be here with you. And we are joined today by Angeli Walton. Now, I'm going to tell you a little bit about Angeli and the reason why we invited her today as a podcast guest. Angeli Walton has her bachelor's degree in dental hygiene and is a registered dental hygienist in Utah. My state. We're state neighbors. And she is a Utah native, raised in a city named Holiday, and is a dedicated dental hygienist, mother of four living mother of four. I'm reading this and I'm like, she's mother of four and living in Utah. I'm glad they're all living, and I'm glad you're all living in Utah, but you live in Linden, Utah. And after attending Brigham Young University and BYU Hawaii, she graduated with honors from the Utah College of Dental Hygiene in 2009. Over the course of 16 years, she built a strong career working in private dental practices across the state. While she now limits her work to the occasional temp jobs, Angeli remains passionate about health and wellness. And we invited her to be on the podcast today because she is also a cancer survivor. And we want to talk to Angeli about how she was diagnosed and how that shaped her as a practitioner. So, Angeli, thank you so much for being with us.
Yeah, it's great to be with you guys. This is exciting. It's my first podcast ever, so
And that
got
we love that. We
got
love that. Thanks for
got me out of
saying
my
yes.
comfort zone, and so this will be a fun new experience.
Well, you're making out of the comfort zone look pretty comfortable. So we're glad that you are here with us today. And we want to know a little bit about like we were talking before we started, and I was expressing that I now go to the dermatologist twice a year because my skin is like a welcome mat to particularly strange looking moles. And you were expressing this that you just had a little mole or tell us more about what happened.
Yeah, I
And
just had something weird, like little red spot on my face, and I was like, I better get this checked out. And sure enough, it was precancerous. So I was like, oh great, this is my third type of cancer.
third type of cancer. How did you find the first?
So the first one I had was thyroid cancer, and I'll tell you later, but like I think that it honestly saved my life, the diagnosis of thyroid cancer, because it led me to find a more serious, deadly kind of cancer, which I can
Oh.
tell you about later. But yeah, so I was actually just totally unexpected. I just had my third baby, and it was a boy, and I was at my postpartum checkup, my 6-week one. And at the very end, my doctor said he wanted to do a physical. And so he felt my thyroid and he said, this doesn't feel quite normal to me. I want you to go get some labs done and get an ultrasound just to rule anything out. It's probably fine, but just wanted you to go get this checked out. And honestly, I was pretty annoyed at first. I was a mom of 3 little kids and thought I don't have time to go to another doctor's appointment. This was hard enough. And I'm totally feel healthy, and this is just such a hassle. And I don't have more time for this, but I just couldn't put off the feeling that something might be wrong and I should go check it out. So I went to the hospital to have a thyroid ultrasound done, and I had it on a Friday, and the ultrasound tech said that she was confident that the radiologist would know what it was that she found. And I was like, wow, thanks for ruining my weekend. Like,
You're
not
like,
gonna
you
know.
found something? W
Yeah. So I just couldn't believe that she found anything and kind of said that to scare me, but I just kept telling myself it was fine, it was fine. Then what felt like days, they called and said that they found a thyroid nodule, which I didn't know what that was at the time, and they needed to do a biopsy on it. So I went back to the hospital and they put 7 needles in my thyroid to take little fluid samples out of the the nodule.
They needed 7?
Yeah, 7 needles. It was a lot more painful than I thought and a lot scarier and harder recovery than I thought. But, the guy that did it was like, "Oh, I think you're fine, like, this just looks like it's really fluid filled and nodules are really common, and most of them aren't cancerous and you'll be fine." So, I was, like, feeling okay and just still mad I had to go through all that. Then the biopsy came back and, like being a hygienist, I think we could understand all the medical terms in it. I was like, "Oh, I can read this," and you know how sometimes you can get it online before the doctor calls you about it. So, I looked through and it said it was inconclusive. So, I was like, "Oh, good." But then he referred me to an ENT who I'd found that was like a really good or I'd heard that he was a good thyroid like special cancer specialist. And when I went in, he immediately said, "You have cancer." And I was, like, just shocked because
You're like, "I thought you said it was inconclusive."
uh, yeah, and everyone along the way was like, "You're gonna be fine, you're gonna be fine." So, that was just not a word that anyone wants to hear when they have a little baby and 3 energetic toddlers at home, and so, yeah, I was just really scared. He said, "We need to do surgery on you. We'll start by removing half of your thyroid, and we'll do a biopsy during that." I forgot to say that the biopsy that they did with the needle, I
Mhm.
guess those aren't very accurate because it depends on where they put the needle in to get the tissue samples. So they could get a spot that wasn't cancerous or something, and you could still have cancer. So
So
the most accurate.
they needed 10 instead of 7.
Yeah, yeah. Well, the most accurate is a surgical biopsy. So that's where ultimately he found that I had cancer. On one side, there's a 1 centimeter cyst, and then on the other side, there's a really small amount. So they ended up taking out my whole thyroid. And
Hmm.
he also took lymph nodes around the area to check those, and they were all clear. So that was really, really good news. And that's because we caught it so early and it stayed encapsulated and didn't spread. So I'm really, really lucky that was the case for me because I've heard lots of other stories where it's way sad and it spreads and you have to get that radioactive iodine where you have to get, isolated, and it's really
Mhm.
scary, and I had a newborn baby, so I was so glad I didn't have to do that.
Yeah, my friend had to do the iodine, and he had to stay in, like, a different part of their house for,
Right.
like, a week, and, like, his wife would put out his dinner and let him know that it was outside the door, and then she would go to the other side of the house, and then he'd come out and get it and then go back into his radioactive hole.
Yeah, so scary. Oh, I was really, really glad I didn't have to do that, so the weird part is I just didn't have any signs or symptoms at all, like, the whole time. Even when my labs came back, they were normal, and the only thing looking back that I can think of was after I had my baby. You know how you can't lay on your back when you're pregnant? And after I had the baby, I could finally lay on my back, and I was like, "It feels like I can't breathe," kind of, and I thought, "Oh, it's just all these extra pounds that I got from being pregnant, like, and I'm now can't breathe or something and have sleep apnea or something." But when I turned to my side, I could breathe normal, so that was the only sign that I had. But my OB said that he's caught a lot of, like, health problems along with thyroid cancer because when you're pregnant, you're going into the doctor so often and you're able to get screened for things that you normally wouldn't be. So I was so glad that I went, and now I just see an endocrinologist a couple times a year and I do ultrasounds to check and labs and make sure it's not coming back. But I'm considered like a really low risk. So that's really good.
Love how you said your OP made mention that he found it because you see him more often.
Mhm.
And I have observed that most people go and see the dentist's office more often than they go and see their physician. Unless they are being monitored for a chronic illness, they're not going in twice to 4 times a year. But for our hygiene visits, sometimes we see somebody 4 times a year, and what an opportunity that we have to screen for those abnormalities. And
Yeah, for sure.
I'm curious when he told you I'm feeling my thyroid right now, like, but I'm curious when he told you that he felt an abnormality, if you could also feel it or if you are better at detecting now that you've experienced this.
Yeah, so I could never feel it, like, to the touch, but like I said, I could only feel it when I was sleeping. It just felt like something was on my throat, and I couldn't get, like, a full breath of air when I'd lay on my back. So that was literally my only symptom, but it's funny because I saw my endocrinologist a few weeks ago just for a checkup, and I was telling him about this podcast that we were gonna do, and he was like he kinda laughed at me like, "How do you have any credentials to talk about thyroid cancer?" And he was surprised to know that, like, hygienists do screenings or we're supposed to do screenings for this.
You're
And
like,
he
"What do
actually
you
came
mean, what
well,
credentials do I have?
yeah,
First,
well, like,
I
that I
had cancer."
yeah, well, that I wouldn't know how to, like, feel for it in somebody else. And I said, "Yeah, we're as dental hygienists, we're trained to do extra oral exams," and I asked him for some tips, and I wish that he would have done a video that we could share, but it's kinda hard to I don't know if you'll see the video, but, like, he said to look up and push really hard, like, going down 3 times from the jawline down to the collarbone. And it actually kind of hurts when he does it to me, like so we might be scared as dental hygienists, to push that hard on patients because it's kind of a sensitive area. But he did say something interesting that and maybe a lot of us don't feel confident in that, at least I didn't at first, but he said a really big helpful thing that we could do is to determine their risk factors for cancer, which
Mhm.
when we go over their health history, and he told me some of the risk factors are if they've had head or neck exposure to radiation, especially as a child. So something a lot bigger than like dental x-rays. That was the first thing that came to my mind. I'm like, well, is that where I got it from giving x-rays to people for, 10 years? But he said, no, it would take a lot more than that. Or an exposure to like a nuclear accident. It's more common in women than in men. If we have a family history of it, genetics, or like an inherited syndrome, which I didn't have that, by the way, because I got tested for that. Also, an iodine imbalance or any thyroid abnormality like a goiter, enlarged thyroid nodules, or chronic inflammation like Hashimoto's would all be major risk factors for thyroid cancer. So make sure to talk to your patients about those, and then you can feel a little more confident when you're helping them.
Wow, what a story! And guys, there's listeners, Angeli, right now that are either running, walking on a treadmill on the way to work, or probably even listening to this as they're falling asleep. And I want to encourage each and every single one of you to kind of like do that on your own. Go ahead and screen for yourselves. Go ahead and do that palpation around your thyroid and your neck muscles just to see what you can kind of feel, because I oftentimes do this on my patients every for sure every brand new patient. Like that's just standard. Every new patient I want to make sure that they're nice and healthy. Even if I think I don't know what I'm feeling, the good news is I am curious by nature and I want to find out if the patient is at the very least healthy, right? But we oftentimes focus so much on oral cancer, which is inside the mouth, but we forget about things like thyroid cancer and stuff like that. So listeners, go ahead and do yourself a favor, start palpating, and when you go back and to the office and you know take it up for yourselves to be able to kind of say, what difference can I make today? Because a simple physical, what Angeli had, kind of triggered the proper channels of conversations for her to get properly screened.
And be
Yeah.
intentional. Don't be
Hmm.
afraid to cause a little discomfort in order to screen for a bigger discomfort in the future. I think in general, we feel like I'm hearing I don't know what I'm necessarily looking for, and the worst thing we could do is to stop screening, because what I have found in my own clinical practice is the more I screen, the more I can recognize when something doesn't feel usual. Like
Hmm.
I'm palpating that thyroid. It's feeling wider. It's feeling like I was about to say it feels heavier. I'm not like lifting it up, but does that like it feels heavier, or as you move it side to side, to have the patient swallow? Are they having difficulty swallowing? Are they having difficulty getting a big breath? Asking them these questions, and the more often we do that, the more likely we are going to be able to find when something is not in the realm of ordinary.
Mhm, exactly.
How many of us write, WNL, right? And
We
to me,
never
sometimes I
look.
look, we never looked, right? And so, like, we got to challenge ourselves to go the extra mile because you guys can very much be the difference on why that early detection screening it's a life saving screening. It's a life saving exam, right? So, Angeli, thank you so much for sharing that. That's amazing.
I love that you shared that they caught it early, and so you were in an you had a better prognosis because of how early they found it.
Mhm, yeah, for sure. So, so much better the earlier you find it.
And
So,
finding thyroid cancers led you to find something else early? What tell
yeah,
us about that.
it's kind of a long story, so I'll try to tell it fast, but
Oh, you can
after
we're good. You got time.
after I had the actual thyroid surgery, you know how you can get sick from the anesthesia? I
Mhm.
was throwing up, I couldn't stop throwing up. I just had a baby, so it's embarrassing. My 3rd baby, I had hemorrhoids,
Oh, I'm
from all the
sorry.
pressure. So that led me which it was actually more painful than thyroid removal at the time, so I was, like, dying on both ends, and that led me to go to the GI doctor, and he's like, "Man, you've been through so much, I don't really wanna do a colonoscopy," but I wasn't really getting better with my GI symptoms after I'd seen him for a few visits. He's like, "Let's just do a colonoscopy." And when I woke up from that, he said, "Oh my gosh, I can't believe we did that. It just saved your life." He said, "You had a precancerous polyp. The kind that you had was deadly, and you would have been dead in 5 years if
Huh?
you hadn't caught it."
I just
And
got the
I would
chills.
have never, ever, ever gotten a colonoscopy. I didn't my main symptoms weren't GI symptoms, and I don't really know exactly how it led to I just feel like the whole thing was a miracle that everything led to finding that. So,
How old were you when you did the colonoscopy?
I think I was around 33.
Yeah, that is not a usual age.
Mhm. Yeah,
Yeah,
so pretty
that
crazy.
that reminds me of a patient I had. He's a technician, like he's a nurse, and he assists a doctor for colonoscopies. And I asked him, I was like, "What is the craziest things you've seen?" And he's like, "Bro, you have no idea how many people wake up and we have to tell them that they have cancer, and they had no idea that that was going to be a thing. It was probably going to be a routine. It was probably just an extra screening, and we're waking them up from their surgery, and these are the results."
Mm.
And most of them have been, he said, "I've been doing this for 10 years, and most of them I've been in every single day I go to work. I don't expect this to be a norm, and somehow it is." Being able to get these screenings done, and being able to realize that everything when it comes to cancer is just the early detection, guys. Like, it really does make a difference.
Oh, for sure. Yeah, it was the craziest feeling ever waking up and hearing that. Just it was a lot more shocking for sure than the thyroid cancer because thyroid cancer is highly treatable, highly
Mm.
survival, it's really good prognosis, but colon cancer is not, and it's just you don't really know till it's too late. So I just believe that I have the thyroid cancer to lead me to find the colon cancer. So I feel really lucky.
What was the treatment? Did they just remove the polyp,
Yeah,
or did
just
you
yeah, they had already removed it while I was asleep, so it was gone, and now I just have follow-ups every 5 years or something, so yeah, it's not bad, like the early detection we talked about. Super easy.
Because 33 is really young.
Mhm,
I think that the recommended time for a colonoscopy, somebody check me, but I think it's around 45. The
yeah,
I went and had a colonoscopy this year, my 40th year, because I have some risk factors. I have some parents with some previous polyps, things like that. So I was high on the risk list and went in earlier than most people do. And from your subsequent colonoscopies, have you stayed pretty polyp free?
Yeah, yeah, there was nothing the last 2, so they decided to space them out a little bit further. So, yeah, that's so great.
Yeah, because the
That's
only
Oh, I
thing
wish they would lower the age. It seems like lower or younger and younger people are getting colon cancer. So,
Yeah, it's cancer doesn't discriminate, right? I mean, there's high
mm,
risk factors, but I mean, I shared a story that my niece, who's 7 years old, she was diagnosed with eye cancer, right? And so, for a 7 year old, just don't think about it. And how it happened is she essentially had like a pink eye, and it just overnight just swelled up. And she went to the doctor, and within 24 to 48 hours, it was confirmed that it was cancer by a biopsy. So you don't know how quickly your life can change, whether you're a mom of three, four. I'm thinking of my wife because we have three kids, or my child who is, around that age group as well. And I have to ask you, for the sake of all of us who are dental professionals, what are some of the things that we could be doing the very next day when I'm going to work, or as we finish listening to this podcast on the way to work? What are some of the things that we can tell ourselves, or some of the things that we can ask the patients or share with the patients to kind of go that extra mile and do screenings, not only, oral cancer screenings, but, beyond that?
yeah, for sure. I mean, we think we're so busy and always behind schedule, but it really doesn't add, I mean, 30 seconds to go like this, and talk
Mhm.
to them a little bit about it, their risk factors. I was thinking it might add like 5 minutes to do that. Like, obviously for me, I tell them my story a little bit and they're like, yeah, for sure, check me out. But you could just say you heard a podcast about this and how common it's getting to have thyroid cancer, or just I think all the patients would be so happy that you were being so thorough and willing to go the extra mile to check that stuff. I would always want to go back to a dentist that was like that for sure. Yeah, and if it's hard too, I thought about getting your dentist or office manager on board to giving you like 5 more minutes to be able to do that, fully.
and how many of us are waiting 5 minutes for the dentist to come and do the exam?
Mhm.
And
Anybody? Anybody waiting 5, 10, 15 minutes for an exam? And instead of sitting there giving the dirty eye to your dentist, how about go back into your op and say, while we wait for Dr. So and so, I'm going to perform an extra oral exam. I'm going to be looking for any lumps or bumps that are out of the ordinary. And if there's anything that is unusual, we'll refer you to someone who could take a closer look.
yeah, that's a great idea for
And
sure.
with those those waiting moments.
I think that's a great idea. Just don't go around and doing colonoscopy, guys. That's a whole different profession, though.
Out of my scope of practice, Dave.
Wrong
I
end.
Wrong end. My little sister is a nurse, and people often ask, like, "Why didn't she become a nurse?" or "Why didn't she become a dental hygienist?" And, she would joke, she's like, "It's because I like to work holidays." That's when I became a dental hygienist, and I joke that I'm like, "I don't wanna work with I work with one stinky end, but I don't wanna work with the other stinky end." I really don't. I am uninterested in that.
Seriously.
So, Angeli, I was wondering how this experience has shaped you professionally.
Professionally, this has taught me to keep an open mind and to just never stop learning, no matter what. Like sometimes you think you're done with school and you don't need to learn anymore, but just going through all these hard things has taught me to keep learning and studying and researching to help my family and friends and patients. It's influenced me for like positive and negative ways. I think
Mm.
like I've become kind of a hypochondriac because once you get that diagnosis of cancer, and especially two kinds, you just start to obsess like, how did I get this? And what can I do to prevent it? And why did this happen to me? And like that was the first question I asked the ENT that diagnosed me. I said, how did I get this? Like, I didn't do anything. I wasn't radiated or
I wasn't breathing any cancerous cells.
yeah, I don't have it in my family, or I feel like I eat pretty well and like don't smoke or drink. And he said, he basically told me like, you're never gonna find out how you got this. And so stop wasting your time worrying about how you got it. And I just didn't like that answer because I feel like we can prevent a lot of things. And And so it got me like really motivated to learn and study and to help my kids better. And I just kind of became passionate or maybe obsessed with health for a while. Went on like some crazy diets and I don't know, just went down that whole road of like changing everything in my house, like all the products that I used and all the food. And that was also really bad for me too because it was so stressful. But I'm in a better place now and just trying to do my best with what I can and make small changes where I can. But I am grateful for the knowledge that I've gained and like the empathy that I've gained with to have with my patients that have these big long health histories. Before I was like, "Oh my goodness, like these people, I feel so bad for them, but they have all these things." But now I just like, well, I didn't do anything to get this and they maybe didn't either, and just have more sympathy for what they're going through in their life. So yeah, it's just basically helped me to keep learning, never stop learning and expanding your knowledge.
That's beautiful, and that's so impactful. And the fact that you came the other side and so much stronger, so much wiser. We spoke about a lot of important things. I feel like we just don't have enough time with you because I can literally interview you the whole week rather. But you know, because of that, what message do you hope hygienists take away from your story? What are some of the biggest, most important things that if you can speak to hygienists out there through this podcast, what
Yeah,
would you want them to take away?
yeah, for sure. I would say that taking that 5 minutes extra time when even when you're so stressed and busy and you've seen those like 40 patients that day, just take that extra time because it will be worth it for that one person and how much it's impacted me and my family. And I'm so grateful that that doctor took 5 minutes to do that for me. And even though he wasn't like 100% confident what was wrong, he knew where to point me to the right direction. I think that's what we can do as dental hygienists. Even if we're not like 100% sure what's going on, we're going to be one of the first line people to catch things. And we have such a huge knowledge base from dental hygiene school of like so many things, pharmacology, microbiology, all these
Mhm.
different things. We've learned so much about the whole body and its connection to our oral health, and we're such a great resource for our patients. And just to take that extra 5 minutes to be thorough and communicate with them why you're doing what you're doing and that you care about them and their overall health.
That's
Angeli, that
amazing.
was beautiful. That was a lovely end message. And thank you for coming and sharing your experience and how it's shaped you and how it can continue to shape those who listen to your experience. And thank you so much for being here with us. And just what Angeli said, I hope you're not seeing 40 patients, but I hope
It
you do
feels like
take
it.
it feels like it. And I hope you take that extra 5 minutes to make a difference in somebody's life.
Yeah, for sure. I'm so grateful for the doctor that did for me.
Thanks, Angeli.
Angeli, thank you for sharing your story. You're an amazing person.
Oh, thank you guys. It's been a great experience. I appreciate it. And
You're
just hope it will
welcome.
help someone else.
I think it will. I think it will.
You already have.
That's right. You already have. That's a wrap on today's episode of A Tale of Two Hygienists podcast. If this conversation made you feel seen, inspired, or even just a little fired up, share it with a fellow hygienist or fellow dental professional. Share it with your neighbors, your friends, share it with everyone. That is how this community grows.
Make sure you subscribe, leave us a review, and connect with us on social media so that we can keep on going with this conversation. Remember, your career, your voice, and your story matter here. We're David,
And Jessica,
and until next time.
keep learning, keep laughing, and keep showing up for yourself and for each other.
This has been a production of Endeavor Business Media, a division of Endeavor B2B.